Hi, I'm Dave. Anencephaly is a cephalic or brain disorder that results from a neural tube defect that occurs when the cephalic head end of the neural tube fails to close, usually between the 23rd and 26th day of pregnancy, resulting in the absence of a major portion of the brain, skull, and scalp. Children with this disorder are born without a forebrain, the largest part of the brain consisting mainly of the cerebral hemispheres, which include the cortex, which is responsible for higher-level cognition like thinking. The remaining brain tissue is often exposed, not covered by bone or skin. Anencephaly can often be diagnosed before birth through an ultrasound examination. The maternal serum alpha-fetoprotein, AFP screening, and detailed fetal ultrasound can be useful for screening for neural tube defects such as spina bifida or anencephaly. The cause of anencephaly is disputed. Genetically, neural tube defects do not follow direct patterns of heredity, though there is some indirect evidence of inheritance, and recent animal models indicating a possible association with deficiencies of the transcription factor TED2. Studies show that a woman who has had one child with a neural tube defect such as anencephaly has about a 3% risk of having another child with a neural tube defect. It is known that women taking certain medication for epilepsy and women with insulin-dependent diabetes have a higher chance of having a child with a neural tube defect. Genetic counseling is usually offered to women at a higher risk of having a child with a neural tube defect to discuss available testing. Recent studies have shown that the addition of folic acid to the diet of women of childbearing age may significantly reduce, although not eliminate, the incidence of neural tube defects. Therefore, it is recommended that all women of childbearing age consume 0.4 milligrams of folic acid daily, especially those attempting to conceive or who may possibly conceive, as this can reduce the risk to 0.03%. It is not advisable to wait until pregnancy has begun, since by the time a woman knows she is pregnant, the critical time for the formation of a neural tube defect has usually already passed. A physician may prescribe even higher dosages of folic acid, 4 milligrams a day, for women who have had a previous pregnancy with a neural tube defect. Thanks for listening. Goodbye.